Hello, everyone. Welcome to the webinar. My name is Elvia. I'm the Associate Manager of Information and Referral Services at NCFH, or National Center for Farmworker Health. So thank you so much for joining us today. Today, we're going to be discussing the Call for Health or Una Voz para la Salud program and how to navigate the healthcare system. First, let me start by saying that Call for Health or Una Voz para la Salud was established by the National Center for Farmworker Health in 1997. It is a nationwide, toll-free, bilingual in English and Spanish health information and referral service program for farm workers and their families. However, we also provide support to the community migrant health centers that serve farm workers, the same as organizations that help serve farm workers. The purpose of the program is to increase access to healthcare services for migrant and seasonal agricultural workers and their families. You can contact Call for Health by calling our helpline, which is 1-800-377-9968. We also have a WhatsApp number. It's 1-737-414-5121. And this number is especially good for farm workers who come from other countries. They still have a phone that is not a US phone, so they communicate through WhatsApp. And so that's a good way for them to reach us. So we encourage you to also provide our WhatsApp number. We also have social media channels, which is on Facebook and Instagram. You can find us Una Voz para la Salud. I encourage you to follow us. We always post information regarding to the health about farm workers and information about our program. So please share this with farm workers. So let's start by talking about the services that we provide. At Call for Health, we connect farm worker families to the closest community migrant health center so that they can access healthcare. However, if we cannot find a migrant health center close to them, then we try to find a health department or a free clinic. If that is not accessible either, then we contact providers, private providers. And first, what we do is we contact the provider, make sure that they will accept the patient. We try to negotiate the rates also for self-pay patients. That way the farm worker can have easily access to healthcare. I'll give you an example of how Call for Health has assisted other families in agriculture. For example, this farm worker in Florida, he called us because he was in need of needs of the family, but not only that, his wife needed ongoing dialysis treatment, and he had been calling different places. He was not getting any help, so he was feeling helpless until he contacted Call for Health. We were able to provide information and resources, for example, food pantry that the family needed. We also called different facilities until we found a place where they accepted the patient, and we also negotiated the cost of the service to get dialysis treatment. So you can imagine how the family felt after receiving the services. And most important, he said to us that he liked that Call for Health listened to him and provided comfort throughout this process and difficult situation. So this is a way that Call for Health has helped families. The services that we provide also are that we negotiate for reduced rates with private providers. That way we can lessen the financial burden of the farm worker. So we ask the provider, can they give them a Medicaid rate? Or maybe we look for facilities where they have a sliding fee scale, or work out a payment plan for the farm worker, especially like with hospitals or major things. Then we ask if there's any type of assistance. If not, then at least work out a payment plan that is affordable to the family. We also provide interpretation services when there's a barrier in language. For example, when the farm worker calls a health center and they don't have staff that speak Spanish, then they call us and we are on the phone with the patient. We're able to help them schedule the appointment, or after the appointment, if they have questions or need more assistance, and again, they call us and we serve as interpreters. And now that the farm workers are going to pharmacies or other locations to get the COVID vaccine, if the staff administrating the COVID vaccine do not speak Spanish, then we're on the phone with them also and making sure that we help them get the COVID vaccine and serve as interpreters in that case. I'll give you another example of how we have assisted a family. So this family was in Kentucky. This time the wife called because her husband, I'm sorry, was in a lot of pain. He needed a tooth extraction. He had been to another dentist who diagnosed the treatment, but the cost was going to be a lot for them. So they couldn't accept the treatment there. So they called us. We called different dentists, clinics, and finally we found one where the provider was really kind and accepted the patient and also provided a discount. The only requirement is that we paid everything in full that day of the visit. So between Call for Help and the farm worker, we were able to share the cost and made possible that the farm worker got that tooth extracted and he was no longer in pain. So that was a happy ending. Speaking of financial assistance, so yes, Call for Help offers financial assistance to farm worker families. These funds come from people, organizations that have donated to Call for Help. 100% of the donations that we get go towards helping farm workers. We never take out percentages or anything for administrative work or anything like that. 100% is utilized to help farm workers. So the requirements to receive this type of assistance is that the patient or immediate family member must have worked as an agricultural worker at least 6 months within the last year, or be a retired farm worker, or a farm worker who got injured in the job and no longer can work, then they can apply for this assistance. And immediate family means, for example, if the husband is a farm worker, then that will cover the wife and children. Or if an adult child is a farm worker and he is responsible and cares for the parents, then those parents will also receive our assistance. And the patient does not have to prove that they're legal here. We never ask for a social security, or we never ask for legal status to receive our services. And also I wanted to mention, before we provide financial assistance, sometimes we try to locate local national resources before we provide any assistance. And I'll give you an example. For example, for vision, even though we provide assistance towards surgeries or treatment, however, we don't pay for eyeglasses because we have found other organizations that provide this service. So we help the farm worker apply for those resources before we can help. If they are denied because of X reason, then we are able to help with that. However, we first locate any other resources to help the farm worker. So the financial assistance can be for specialty care. For example, for primary care, as I mentioned, we try to locate a community migrant health center first, where they paid according to their income if they apply for the sliding fee scale. But for other services that are not covered in the health center, when they are sent to see a specialist, that type of assistance we can provide. For example, paying either for the consultation or part of the consultation and or treatments. So it covers specialty care, or it could be for surgeries. However, it must be considered critical, and it excludes cosmetic procedures, diagnostics, or to rule out cancer. In a case-by-case basis, we have waived this when in its regards to diagnostic tests, because sometimes it's something urgent need, or we see the case and then we say, okay, in this case, we will help with this diagnostic procedure. And I can tell you right now, we cannot pay for the whole treatment or the full surgery because we don't have the funds, but at least we help with something. That way we secure services for the farm worker family. We also help with vision, like I mentioned before, with surgeries or treatment that are needed to prevent loss of vision. Dental, we also help with like root canals, extractions, things that are going to help the farm worker not be in pain and they can go back to work, but it excludes, of course, cosmetic treatment like braces and everything related to treatment. Anything that is going to help the farm worker stay healthy or regain health, we help or try to help in that case. Again, we cannot pay for all the treatment. Sometimes it's a lot more than what we can help, but it's something. And the farm workers are always appreciative of the type of help. So it could be for physical, occupational rehabilitation therapy, radiation, chemotherapy, mental health, the list goes on and on. Anything related to a treatment, we can help. Now, medication, we also help with medication, but it has to be short term. And I'll give you more details in a minute. So Call for Health cannot reimburse for things that are less than $20 or pay for cosmetic, anything, right? We cannot pay for over-the-counter medication or pay for chronic condition medication or treatment. And we'll tell you why. One, because we do not have the funds to do ongoing assistance for one patient, but we have found other resources that we're going to learn in a minute. Other organizations, nonprofits, or patient assistance programs that can help with this type of need, chronic condition. So we will learn about that. Next, we're going to talk about making a successful referral. And this is something that we practice here at Call for Health. We don't just want to hand out another number. Maybe they already called 20 numbers, and then we give them another number. It can be frustrating and discouraging for the farm workers. So we try to connect the farm worker to access healthcare or access the things that are social determinants of health, like social needs. And that has helped us. And I'm sure if your organization provides this type of assistance, you're going to find this to be very helpful. So first of all, we keep an updated list of resources. We often check the resources are current and they're still open, for example. If you notice that you haven't called this resource in over a year, I recommend that you call them just to check that they still provide the services that you have there. Or sometimes the requirements change. So we like to call before we send a farm worker to another source. We also provide not just a phone number, but we try to provide like an address, hours of operation, and a brief explanation of the requirements, if there are any. For example, when we send a farm worker to a community health center, we explain to them, okay, if you don't have health insurance, you can apply for the sliding fee scale. And then we explain the requirements. Most likely they're going to ask you for an ID, and they're going to ask you for proof of income, like pay stubs. If the farm worker says, well, I don't get any pay stubs, I get paid in cash, then we provide other options like, okay, they're probably going to ask you for a letter from your from your employer, or ask for other ways that you can provide proof of income. So we explain those things before we just share information about the health center. And speaking of health centers, so today we're going to learn how to locate the closest community migrant health center to the farm worker. And for that, we're going to use a very nice tool that the Health Resources and Services Administration has, or HRSA. This website, you can easily enter a zip code here and locate the closest community health center to the zip code that you entered. You can also type in the town or the city and state, and you will get results. But I recommend that you use the zip code instead, because if, let's say, you are locating a health center in a large city, you're going to get many results, right? But we want to find the one that is closer to the farm worker. So having the zip code is the best way to access the closest health center. So for this, I'm going to demonstrate how to use this tool and how to do this referral. So I'm going to share my other screen. And here we have the website. So here I'm going to type in one example. For example, let's say I ask my farm worker, where they are. He says, well, my zip code is 49013. And I asked him, before I assume it's Bangor, Michigan, I asked, are you in Bangor, Michigan? Because sometimes it happens that they give you that one digit is wrong, and then if we send them to the wrong location. So make sure you ask them, oh, you're in Bangor, Michigan? Yes. So now you type, okay, you start searching and you get results. So let's look at the first one, which is Intercare in Bangor. You see that it's operated by Intercare Community Health Network. You also have the address, the phone number, and all the information. But before I send the farm worker to this address, I like to confirm if this address is accurate, because sometimes there's changes, or health centers have temporarily closed because of COVID or other reasons. And sometimes it takes a while for the update to come here to this site. So I would like to see if this is accurate. So I'm going to go to the website, and this has a link here. So you click on the link of the website. And once you're there, I'm going to go to locations, and I'm going to find Bangor Healthcare. And this is the address that I'm going to give the farm worker. This is a phone number that I'm going to give the farm worker. And you have the hours of operation here. That way you can also have that access if the farm worker asks what are the times that they're open. We can give them this information. So this is one way. I'm going to show you another example, another town, so you can also see the results. So this time, this farm worker is at this zip code 28103. And I asked them, okay, are you in Marshville, North Carolina? He says yes. So let's look at the results. If you notice, the miles away from the zip code change from 5 to 10. So this website is going to continue to search until it finds the health center. Sometimes it could be 30, 40 miles away. But this automatically won't change. So we found one result. This is Arms Union, and this health center is operated by Anson Regional Medical Service. Again, I'm going to search in the website to see if this information is accurate or the address has changed. This, you notice there's no website. So what I do is I do a quick Google search. So I'm going to copy this name of here. I'm going to paste, and I found the website here. So I see that they have 2 locations, and I'm going to check just in case if there are any notifications that the site is temporarily closed or anything like that, because sometimes it happens. They have a note that this location is relocated or something. So it doesn't seem like that is the case here. So we're good to go. We can refer this patient, this farm worker, to this address. We also see here the hours of operation, phone number, and all the information here. So yeah, this is a way you can use a HRSA Find a Health Center tool. So let's go back to the presentation. Very well. So yeah, that's how you find a health center close to a farm worker. Now, what about hospitals? Well, let's provide some resources with hospitals. Well, most hospitals will work out a payment arrangement with the patient or accept a deposit. Also, patients can apply for indigent funds at the hospital. So you can call the hospital and see if there's some type of program, charity programs. And to apply for those programs, most likely they're going to ask for proof of income. So prepare the farm worker to have that accessible and ready to provide. And most hospitals do not discriminate on immigration status. So if it's an urgent situation, most likely the hospital should not accept the patient if it's an urgent need. What about medication? Well, we're going to learn about PAP, or prescription assistance programs. Those are charitable programs offered by pharmaceutical manufacturers for medications offered at a free or very low cost to qualified patients. And I'll give you a couple of examples of things that have been very useful here at Call for Help. So we have the RX Outreach. It's a nonprofit pharmacy. You have their phone number and the website. So RX is a nonprofit mail order pharmacy that provides over 1,000 affordable medication strength to people in need. The website says that the fee is $10 for a 30-day supply of medication, $13 for a 90-day, $20 for a 180-day or 6-month supply. The fee covers already the administration costs, including shipping and handling. So it's a very easy to navigate website. I like it a lot because it's easy to find whatever you're looking for. And it is recommended that the patient can go to the list of medications to see if they have their medication that they were prescribed. If not, it is recommended that the patient can ask the provider if they can come to this website, look at the list, and to check if there's another prescription that is, or medicine that is compatible to what they need. And if the doctor finds it, then the doctor can provide a new prescription. The patient can come back to the website, create an account, select the medication, and then provide the payment plan or the payment source. For example, are they going to pay with a credit card, with a debit card, or directly from their checking account? And once they do that, the patient is going to receive the medicine according to what they selected, like every 30 days, every 90 days, or every 6 months. It will be shipped to their home. So to see if people can apply and see if they're eligible is very easy. Again, we help farm workers do this process. So I encourage you to send farm workers to our program. That way we can help them and see if they can apply for this service. And what I like about this nonprofit is that most of places will ask for a proof of income, or for example, a tax return or pay stub. Well, this website doesn't ask for that. The information that the patient puts in there in the signature attests that the information provided is true and accurate. So this is very nice, especially for farm workers. Sometimes it's difficult for them to provide proof of income. So this website has been very helpful. Another website that we use is the needymeds.org. You find the phone number here. Well, this one, you can search in this bar for the medication that the farm worker needs. It gives you a list of pharmaceutical companies or programs that offer that medication free or a discounted price. If the person doesn't feel comfortable, navigating the website, they can also call this helpline and ask for assistance. Another thing that you can do in this website is that you can find help locally. For example, you type in the zip code and it creates a list of organizations or places a person can get assistance in person to find medication, or that will help them apply to get their medication for free or at lower cost. So this is a neat website for medication. Now let's talk about vision. So we found this resource that is really nice. It offers free glasses for people who need eyeglasses. And the only thing is, an organization, a nonprofit, can reach out to them on behalf of a patient. However, during COVID, it says on the website that during COVID, New Eyes is accepting applications from individuals who have been affected with COVID. So if this is the case, you find people that have been affected by COVID, they can directly apply for this service. If not, we can help them. If they are farm workers, we can help them with the process of applying to get new eyeglasses. They also need to have a prescribed note that is less than 24 months old. So the farm worker will have to go get an eye exam first, and then once they have the prescription, we can help them apply for new glasses through New Eyes. Now let's talk about cancer support and financial assistance. So we have this resource, it's called Cancer Care. They have over 75 years of experience helping individuals who have been diagnosed with cancer. So they not only provide financial assistance, but they provide counseling, case management, especially during this time when they're going through a lot. It's nice to have someone that is helping them coordinate either appointments or financial issues. It's nice to have some support, so they provide that. They also have a list of group supports. So if the person would like to join a support group, then they can call this number and find one, a support group local to close to them. They provide also education about their condition. And in regards to financial assistance, well, they say that in order to be eligible, then the person needs to have been diagnosed with cancer by an oncology and be under treatment, right? Under cancer treatment at the moment, live in the US or Puerto Rico, and meet the eligibility guidelines based on federal poverty limit. And this is their website and phone number. And for women, we have this resource, Susan G. Komen Foundation. Susan G. Komen Foundation helps not only when they have been diagnosed with cancer, breast cancer, but they help from the beginning, for example, with screenings. They have grants and different clinics that they provide free mammograms or free sonograms to diagnose cancer. And after that, like it says here, they provide a treatment assistance, or they also have information and resources for the individuals. You can call this number, which I also translated here, 877 465 6636. That is what you see. Go Komen is this number right here. And they have an email where you can also send them a message and our hours of operation. Another resource is the American Breast Cancer Foundation. And they also provide financial assistance, but it's in a first come, first serve basis. And there's an approval process, which they do ask for proof of residency and income to see if the person qualifies. If the person does not qualify, they also have a list of resources. So they will guide the person to other resources that they have in their network. And other resources that we have found are this, Chariots of Love. This organization provides free wheelchairs and free wheelchair repairs for children and young adults through the age of 21 in the United States. So here we have their website and an email address. Now we have Limbs for Life Foundation. And this is a global nonprofit organization dedicated to providing fully functional prosthetic care for individuals who can otherwise afford it, and raising awareness of the challenges facing amputees. So this is another nice organization providing assistance. Now, what about COVID resources? Well, of course, in Call for Help, we have a directory of resources and also national resources to, for example, find COVID testing, COVID vaccine. We help farm workers locate a place since they move from one state to the other for work. If they started the vaccination dose one in one state, they move to another location, we find them something close to them. For example, recently, we just helped a group of farm workers who are in North Carolina and needed the second dose of Pfizer. So we provided that, but then he said, well, we are gonna move next week to Florida. So we found them another place in Florida, but they were gonna continue to work in Florida. And we provide resources for both places. That way, if they didn't have the chance to do it in North Carolina, they could then find another place in Florida. So we provide that. But we also have at NCFH, we have a page dedicated to resources related to COVID vaccine or testing. And this page, you will also, for example, will find things like flyers that you can easily download or print or send electronically to farm workers. And you also find short videos, educational videos, PSAs in Spanish or in indigenous languages. And also you can navigate this page to see what resources we have in indigenous languages from Mexico or Central America, Haitian Creole. It's a really nice resource. We're about to update this page. We're going to make it easier to navigate. It is easy to navigate right now, but we're going to make it even more easier for you to find resources, locate resources in the languages that you're looking for. We always try to find resources that are going to be, what's it called? Language and culturally appropriate for the farm worker community. Sorry about that. I was like trying to find the right words. Again, I want to remind you how to reach us, and you can call the 1-800 line, the WhatsApp, or you can also follow us on Instagram or Facebook and send us a message there if you need to contact us. I want to thank you so much for attending this webinar. Here you have my contact information. If you have any questions about the program, please send me an email. You can also call my number. Have a great rest of your day. Thank you.